This is Washington Unplugged, and I'm Sharyl Attkisson. We begin today with the latest on the health care reform debate, and joining us for an update on that is the Washington Post's Ezra Klein. Let's begin by setting the stage in simple terms. There are all kinds of ideas floating around. We're hearing about several different bills. What do we need to know today?
Well, you need to know there are a lot of ideas floating around, and there are several different bills. What people are watching today is in the Senate primarily. So the House of Representatives has come out with a bill. The bill has gone through 2 of the 3 committees, and we presume that they will pass something along the lines of what we've seen there. The Senate, we don't know yet. The Senate has not come out with a bill. The Senate Finance Committee, which is the primary committee for health care reform, the committee that decides the money that controls Medicare and Medicaid, the committee that's really the sort of key driver of this, has not come out with a bill. And more to the point, their process has become very strange. The Senate Finance Committee isn't working together on a bill. Instead, 6 members of the committee, Max Baucus, Chuck Grassley, Mike Enzi, Olympia Snowe, Bingaman, and Ken Conrad,
Democrats and Republicans.
3 Democrats and 3 Republicans have been meeting in private, sort of behind closed doors, to hammer this out. Now they say they're near an agreement, but as of now we don't know what the agreement is.
Well, the question
nor does anyone else.
Yeah, the question I've heard the past couple of days has to do partly with that. Yesterday there was word leaking out of that group that, oh, the public option has supposedly been killed, or the public option must be in there, or else it's a non-starter. When people talk about the public option in simple terms, what are they talking about?
They're talking about an insurance option, one insurer you could choose, just like you can choose Aetna or Kaiser or United Health now. They'll be run by the government. It's no more complicated, no scary, or no more effective than that. I think when all is said and done, the public option will not be nearly as important as liberals hope, nor as devastating as conservatives expect. I think it'll be one thing among many.
When they're talking about it being in or out, if it's out, isn't that the heart of what Democrats wanted to do? I mean, it is the public option at its base, isn't it?
It's the heart of what many liberals think is important about the policy. But, I was writing on this yesterday, but look, 5 years ago, nobody ever talked about the public option, right? Howard Dean didn't have it in his plan. John Kerry didn't have it in his plan. Bill Clinton's plan, which many Democrats wish had passed, didn't have a public option. This is not what has kept health care reform at the forefront of Democratic politics for decades. It's about covering the 47 million uninsured, ending medical bankruptcies, protecting people from insurers. The public option is an important policy and a really important policy experiment. And that's a key point. But it is not the only thing going on here, and at times folks have a tendency to paint it as such.
If voters or Americans want to read some of this stuff that's being developed before it's voted on, how can they? I mean, whether we're talking about the House or the Senate, if the average person wants to go somewhere and see what's being crafted, what can they do?
Well, I would highly recommend my own blog here at the Washington Post, which tries to do that. But if you're actually looking for primary source documentation, which is dull, but people can get through it. You go to the Congressional Budget Office at cbo.gov. They've put up a lot of pretty useful analyses of these plans. And then you can go to the House Committee and Senate Committee websites, right? Whenever they have something, Finance doesn't have anything yet, but they will. They put it up, and they put up not only the bill itself, which is impossible to read, but summaries, fact sheets, one-pagers, all sorts of different things. Right now, you can go to the House Health and Labor, Education and Labor Committee, and they have, I think, 15 different ways of reading about the bill they brought out. Little one-pagers on 8 or 9 of the most important parts, a section-by-section summary. So, there's really a lot of information out there. You really can follow this from home. There's just a lot to follow, and it's changing very quickly.
All right, 2 quick final questions. What does it mean that House Speaker Nancy Pelosi promised a vote by the end of this week, and that's not going to happen?
It means the vote won't happen by the end of this week. It may happen early next week, or it may get pushed back through August. People wanted the vote to happen before Congress broke for vacation for a bit, for obvious reasons, right? You don't want to be working on something and then suddenly everybody goes home in the middle of it. But if that doesn't happen, then the vote will, presumably happen when they get back.
But presumably she didn't have the vote she thought she'd have. They're not as far along as she'd hoped.
Well, it's a little bit more complicated than that even. The problem for Pelosi is not that they don't have the votes. Everything I hear is that they do have the votes. They could pass a bill. The problem is the Senate, right? A lot of congressional Democrats do not want to vote and take a hard vote in the House and then have the Senate cut their knees out from under them. So until they know what Max Baucus and the Senate Finance Committee are going to do, they're not willing to vote on a bill that, say, has a very robust public option, which will anger a lot of industry stakeholders. And then the Senate comes out and says, we're not doing a public option under any circumstances. And House Democrats took that vote for nothing. So a lot of what's going on in the lower chamber has to do with waiting for some clarity from the upper chamber. The relationship between the two right now now is both very fraught, very delicate, and frankly very important.
Ezra Klein, you did a great job breaking it down for us.
Thank you.
Thanks. From the Washington Post. Now, Republicans are working on their own versions of health care reform, and in the House, the Republican Study Committee is prepared to introduce a bill tomorrow. Here with an exclusive preview is Republican Congressman Tom Price, who is a practicing doctor before heading to Washington. First, Mr. Price, in just a sentence or two, what is the Republican Study Committee?
Well, the Republican Study Committee is the group of House conservatives, about 114 of us, self-identified conservatives in the House, that really is the policy, the engine for the House of Representatives on the Republican side.
We get an exclusive preview of the summary of your bill. Let me go through this fairly quickly if we can, but
Sure.
Pillar number one, you say access to coverage for all Americans. Give me a sentence or two on that, please.
Well, the status quo is unacceptable because the costs are increasing and folks are concerned about either losing their health insurance if they change their job or they lose their job. So we believe that it's imperative that each and every American have the access to health care coverage that they select, not that Congress selects for them or that the government selects, but that they select. The way that you do that is through the tax code and make it financially feasible for every single American to have health coverage.
Pillar number two, coverage is truly owned by the patient.
When you own and control your own health insurance policy, then you are able to take it with you. That solves the portability issue, so that you can't lose it if you change your job or lose your job or if your financial status changes. You own and control your health insurance policy, therefore it goes with you and your family.
Number three, improve the health care delivery structure.
It's imperative that we have appropriate structure that changes so that we have wellness, preventive programs and the wellness programs that are in place. Also making certain that we incentivize high-quality care, have transparency in the system.
And rein in out-of-control costs.
In order to rein in costs, you've got to stop the practice of defensive medicine. Clearly $300 billion or more each and every year. That means liability reform has to be at the hallmark, one of the hallmarks of a bill. That's what isn't happening on the Democrat side. We propose that. We also make certain that we pay for our bill by making this a priority. The federal government ought to prioritize, have health reform as a priority. We make it so it's paid for.
All right, and a bit of new news that has just come out I wanted to get your response to. Senator Baucus over on the Senate Finance Committee, the lead Democrat, announced that a bipartisan group, that those 6 folks that Ezra was talking about a moment ago, have submitted a new draft reform plan to CBO, the Congressional Budget Office. And they say the price tag of their plan, which we haven't seen yet, is below $900 billion over 10 years and would ensure coverage of 95% of Americans by 2015. What do you think?
Well, the devil's in the details, as you know. That plan would come in about $400 billion less than the House plan. But we do know that the House plan and the Senate plan in the past has had significant decreases in Medicare, so that you get hundreds of billions of dollars in, quote, savings, but actually that's rationing of medical care for seniors. That's unacceptable to us. And also unacceptable is any significant tax increase on the American people or on small business. We believe that's a job killer and also harms the entire health care system.
Let's take a quick look at a political cartoon. I don't know if you can see it or did see it in the Washington Post, but it shows basically members of Congress in an ambulance running away for the August recess from U.S. health care as the patient lays in pieces at the bottom of the screen. Do you think the public is starting to get a little tired of hearing, the arguments and wondering really where this is going, if anywhere?
Well, I know the public's tired of that. I would suggest, I didn't see the cartoon, but I would suggest, though, that what we're running to is the patient. If we go home over August and talk to our constituents, talk to the patients of America, and get their input on this entire process and on the policy that's being talked about here in Washington, we will have a better product in the fall. Again, the status quo is unacceptable. We've got positive solutions, patient-centered solutions, and we believe that if we're able to have an appropriate opportunity to present those to the American people, then the American people will select solutions that put them in charge, not the government or insurance companies.
Well, maybe you've partly answered my next question with that, but Republicans are coming up with their alternatives. In the end, why bother? Isn't it Democrats that are going to be able to get something passed or not? You don't have the majority, they do. So why are you even bothering to come up with different plans?
Well, the role of the minority is twofold. One is to hold the other side accountable, make them do what they said they were going to do, or hold them accountable when they don't. That's the frustration of the American people right now. They don't believe that this Democrat majority is doing what they said they were going to do. And then second, it's to provide a contrast, to provide that positive solution that the American people can embrace. When we do that, then we believe firmly that the American people will say, hey, those are the folks, those are the guys and gals that are putting forward the real positive solutions. and then there's an election coming around in 2010, it's important for folks to be able to say, those are the people we want to have in charge leading our country.
We have just another minute or two, and I wanted to show another graphic of a chart the Republicans put together supposedly diagramming the House Democrat health care plan. I think you've probably seen this, but it is a screen full of little pipes and squares. And true or not, which I haven't been able to dissect this and see if we agree that this is, a neutral view of what the plan is. But I think whether Republicans or Democrats try to reform health care, that's a major fear on the part of a lot of Americans, that we're putting a ton of bureaucracy in and nobody will understand it. It's just going to get messed up.
Absolutely. On one side of that chart, you see the patients, and on the other side, you see the doctors, and then all of those things in the middle. And all of the things that are colored in the middle have a different color to them, are different kinds of programs and different kinds of commissions and entities, bureaucrats, if you will, that will be in place. Those are new programs, new federal programs. That's not what the American people want. American people want a system that allows them and their families to work with their doctors, compassionate and caring doctors, and come up with the right decision. Not the government, not insurance companies.
All right, quickly, as of today, your guess. What are the odds that Congress will pass a bill by the end of this year that is similar to what President Obama has been pitching for the past months?
Well, I don't think that the Congress or that the nation wants a government program. They don't want a government takeover of health care. And I don't think that they want the kind of taxes raised to the level of $800 billion that is currently in the House proposal that the president has endorsed. So if you're talking about that program, I don't think that has a chance of passing. If, however, you're talking about a program that embraces patients and allows them to be the decision makers in the healthcare arena, then that has a wonderful opportunity to pass. We've got the bill, we believe. We look forward to having that debate.
Congressman Price, thanks for giving Washington Unplugged that exclusive preview.
Thank you so much.
And now, as part of our regular series, Unplugged Under 40, Kaylee Hartung interviewed 28-year-old Congressman Aaron Schock. Take a look.
I'm Kaylee Hartung, and we came to Cannon Office Building today to talk to the youngest member of Congress for our new segment, Unplugged Under 40. First up, what everyone in Washington is talking about, health care. Congressman Aaron Schock says young people better pay attention.
It's our generation that will be paying for not only the health care bill that may or may not pass, depending on what it looks like, but also the two largest unfunded liabilities in this country are Medicare and Social Security. And without some serious revenue enhancements, some serious reforms, those programs will both be broke before you and I can draw from Medicare and Social Security. So without a doubt, young people need to pay attention.
This Republican congressman from Peoria, Illinois, knows a thing or two about young people. He's just 28 years old.
This is my office, so it's not real big, but it's big enough to do the people's work. Certainly at my age, I feel very humbled to be here and to have the awesome responsibility. There's not a day I don't walk up the steps of the Capitol and feel very fortunate to be here. It's an exciting job.
Let's talk a little bit about the Republican Party.
Well, I think that just as with the Democratic Party, a lot of it has to do with the personalities and not so much with the platform. Barack Obama was one of the most liberal members in the state Senate, yet he put a fresh face and a fresh personality on what the Democratic Party stood for and did a good job of articulating those issues to the problems of today. And so it's not so much changing what the Republican Party stands for as it is energetically communicating it in a relevant way to people today.
Schock has been in office for 6 months and is 30 years younger than the average congressman. Does that affect your decision making?
You know, it's not. It never has, because I'm a firm believer that you can't predict the future in politics. Like with any profession, you never know what opportunities will present themselves. I'm up every 2 years, and so it's up to the public in Illinois to decide whether or not I'm going to be back here in 2 years. And you never know who's going to die, who's going to retire, or in my state, who's going to be indicted.
A Blago joke, something a 28-year-old can easily get away with. Now, unless you were talking politics in the sandbox, you missed Reagan's heyday. Who is the political hero of your lifetime?
Well, you know, I think what's important, again, is that we talk about issues that are relevant to today. So it's not that Ronald Reagan isn't important. You know, you saw a bust of Teddy Roosevelt in my office when you came in. I'm a student of history. He's a president that I look up to. But what's important is that the issues are relevant to today.
And today, Schock is a busy guy with no shortage of opportunities for media exposure. You've been grilled by Stephen Colbert. I hear TMZ is stalking you and that you've got a GQ photo spread coming up. How are you dealing with this newfound attention and celebrity?
Well, you know, I have to say I didn't expect as much attention media-wise. You know, shows like TMZ were certainly not ones that I solicited, but it's an amazing new audience that folks who would not otherwise have visited my website, but now do because they saw me on TMZ. Same thing with Stephen Colbert. When you're on a show like that, you reach an entire new demographic. And so I think that's important for me as an elected official, but also for my party as I try and help put a new face on the Republican Party.
And maybe a couple of younger faces, too. Schock says he wishes more people his age would run for Congress. For Washington Unplugged, I'm Kaylee Hartung.
Is it me, or does he look just a little bit like the groom in The Hangover? See what you think. Thanks for watching Washington Unplugged. You can find us here every day at CBSNews.com. I'm Sharyl Attkisson, and you can catch my Follow the Money reports on the CBS Evening News with Katie Couric. See you next time.